When COVID came down, we were talking weeks before about developing a plan to respond to COVID, and we immediately started stocking up on PPE, personal protective equipment, started distributing that to our communities. We started increasing our food distributions. We started providing support to our communities to access cash assistance, sign up for unemployment benefits. We started connecting our families that weren't connected. We started getting information out there about COVID, what it is, how do you protect yourself? What do you do if you're positive? While folks are figuring out what to do and how to get it done, we're doing it.
How do we operationalize assistance so rapidly? What is our secret to cutting through the red tape and providing support as quickly as possible? Rooted in that question is the past work that we have done. My name is Namita Brown, and I am a member of the board of directors for Safe Passages. When COVID hit, we were able to provide that rapid assistance because there were these relationships and bonds that had been formed years ago. The relationship and bonds come from the fact that we are part of the community. We are not outsiders that are just rolling in.
The work that we've done and the opportunities that have been presented to us through the pandemic will continue to enhance and further integrate our intersection into the physical health sector. My name is Kimi Tahara. I am the Operations and Systems Integration Director at Safe Passages, where I oversee the vaccine access team, the communications work, and the fiscal team. Our unique ability to have relationships with the school districts, with individual school sites, has just really pushed us to the forefront.
When the pandemic happened, we were able to scale up quickly. Josefina saw where we were going in terms of most likely having to shelter in place. So my program did not shut down, or the baby learning program did not shut down. The model of our program always consisted in providing essential services. We still plan to do food distributions. We still plan to do our programming. It's just going to look a little bit different. At first, people were like, what's happening? It's going to be over the phone more. It's going to be, online. You're probably going to get more text messages, but we're not going anywhere.
We've been there to provide support for a long time. We've seen kids grow from elementary to schools, to middle schools, to high schools, to become interns and volunteers in Safe Passages. And that relationship has allowed us to work faster, quicker, and in a more efficient manner.
It was also an opportunity for us to have conversations with families and hear about the situations that they were in during the pandemic. That's something we always try to do, is make sure that the programs and services that we're providing match what the need is and what families want.
Being able to have that creativity and that leeway to have the autonomy to think about how to problem solve in a creative way that allows us to bring people together in a collaborative manner. For example, we have had about 5 vaccine clinics so far, where the mobile vaccine clinics came to each school site and delivered about 200 or so doses to students between the ages of 5 to 11. That would not have happened without the support from Healthcare Services Agency and the Public Health Department and OUSD.
We really all got behind was supporting families with making vaccine appointments, calling almost every family to ask them, are you interested in a vaccine? What's your occupation? So that we know what phase you're in and if you're eligible, and if you aren't eligible, we'll give you a call back later.
I specifically help with the indigenous people from the country of Guatemala. My name is Aníbal Pablo Ramos. I work with Safe Passages as well as with the Alameda County. I'm a community outreach worker. There is a miscommunication that a person from Guatemala might know Spanish, but unfortunately, it's just not the case. I can repeat whatever you're telling me in a sentence, but it might not make sense in my language.
Mi comunidad no saben bien hablar el español, mucho menos el inglés. Tenemos el primer idioma que es MAM. Mi nombre es Yolanda Bautista Mendoza y mi posición en Safe Passages es para hacer outreach. Muchas familias están con miedo de la vacuna por tantas cosas que andan diciendo en las calles y que salen las noticias y luego ven por las redes sociales también.
So we gotta let them know what's the resource, if there's any new COVID shots, any new boosters.
Salir a decir más a las gentes en las calles o mis conocidos de que hay vacunación, que eso va a ser el proceso, en especial ahora que vienen los días festivos y mucha gente se va a reunir. Quizás no saben muy bien de las vacunas, pero hay que estar estar bien protegidos, en especial los niños y nuestros ancianos también.
One of the things that the pandemic has taught us is that no need is greater than the immediate community needs. And that is the amazing work that is being done by the executive director at Safe Passages and the staff.
We didn't know it at the time, but we had created an infrastructure that could withstand a pandemic. The pandemic, in a way, has been a proof of concept in terms of our organizational functions and values and principles.
When we think about the whole person and we think about how people come to be in their communities, we have to really think about them holistically. And we think about intergenerational inequities and just sort of how families come to be in their communities. So Safe Passages being able to serve people through the continuum of the lifespan. We're forging and building new relationships through the pandemic because of the vaccine access work that we're doing. We're forging new ways into the housing work because of the emergency rental assistance program. As the federal government and the statewide government think about integrating all these different programs together, we have no choice but to continue to shatter the glass ceilings and to really be immersed in the way in which that healthcare is actually moving forward.